So rabies. Hello. So rabies carries the highest, having the highest case fatality of any human infectious disease. Okay. Almost 100% mortality, except for only around 54 humans have survived so far with the proven rabies, but carries almost 100% mortality. So just we'll go through the brief virology. It belongs to the Rhabdoviridae family, the genus Lissa virus. Okay. It's the electron micrography it shows it will show a bullet-shaped RNA virus, and the human rabies belong to the classical rabies virus. Okay, so this is the virus of this rabies, classical rabies virus, the bullet-shaped virus. There are several glycoproteins on the surface of this virus against which we are making these vaccines and antibodies. Okay, so this is the way it spreads. This virus gets injected into the muscles, okay, muscles and the nerves and the skin. And this particular virus has a predilection for neural tissue. Okay, this is a neurotoxic virus. It loves the neurons. Okay. So it gets immediately inside this nerve endings. And through the axoplasmic flow, it travels at a rate of around 0.5 to 1 centimeter per day and reaches the dorsal root ganglion. And from the spinal cord, it spreads to the brain. So that's how this virus gradually reaches. That is an incubation period for the rabies to develop the encephalitis. Okay. So it is believed that it does not kill the neurons as such. It produces some severe neuronal dysfunction, maybe some oxidative stress, there is some NMDA receptor mediated activity and all. It does not produce apoptosis as such, okay, in the CNS. Somehow it produces a severe neuronal dysfunction leading to brainstem paralysis, respiratory failure, autonomic instability, and death. Okay. And the host susceptibility to infection varies. Not all bites produces infection. Even it is said that the presence of the rabies virus inside the dog mouth varies. I think Dr. Ranjini will tell about that. So exposure does not always result in infection and disease. And the type and anatomical location of the exposure that is very important. For example, a bite that injects saliva into the wound, it carries it creates a more productive infection rather than a bite that is delivered through the clothes. Okay, so if the more saliva is injected, it creates somewhat more productive infection. And head and neck bites, because the nerve face and hands are innervated very much, the probability of infection and the number of nerves to receive the virus is very high. So you get the productive infection runs in a very rapid course, and patient very fastly develop rabies. And also the size of the viral inoculum and the virus variants also produces the severe rabies. For example, the bat, the rabies that comes from the bat is believed to be less virulent. Okay, so that's why the patient in the Milwaukee protocol survived this rabies from the bats. And host immunity and genetics also play some role, because, for example, if immunocompromised or transplant patient develop rabies, they very rapidly develop rabies. And some of the these foxes, wolves, jaguars, they are more susceptible compared to other mammals. Okay. So the transmission requires exposure of the saliva from the animal bite. Okay. Sometimes you may get non-bite exposure, like in transplant recipients. Okay. And maybe licks on the mucosal surface also can produce rabies. And aerosol, it is very, very rare. You won't get an aerosol transmission. There are few cases reported in laboratory persons only. Okay. There has been no transmission from human to human rabies case. In infected patients, you are not you're very unlikely to transmit the rabies from a human. Okay, this is a very interesting case of somebody with organ donation. See, nowadays, a lot of rabies patients are, outbreaks are happening, a lot of organ donations happening. Okay, so this particular recipient, the donor, he was admitted with some viral prodromal, some symptom, and this happened in US, and the treating physicians were unaware of the manifestation of the rabies. Okay. Now he came with some disorientation and all. Urine showed cocaine and marijuana. So they thought this is probably some drug overdose. Okay. And he developed subrecurrent hemorrhage as well. And developed coma and died. So the initial impression was that he had some drug overdose and he died. Okay. But retrospectively, when the expert analyzed the case, he had difficulty in swallowing all sort of things. And his organs were transplanted to 4 patients, 2 kidneys and 1 liver, and 1 piece of an artery was transplanted to 4 patients, and all of them developed rabies and died. So it can transmit through organ donation as well. And in incubation period, it is a time taken to travel from the right side to the brain. Generally, it is believed that usually it varies from 1 to 3 months. But bites on the face and the hands, it can produce the symptoms even before. Okay. And so patient who has immunosuppressed, it can be still shorter. Okay. But the incubation period, a very long incubation period has been reported. Very long incubation. For example, this particular case. Okay. This immigrant from Brazil, he developed rabies. Okay, and he had exposure in Brazil 8 years back, and they did the genetic analysis of the virus, and it showed that this virus belongs to Brazil only. That was not circulating in the US. The sequencing. So this is a very clear case that the rabies you may get an incubation period up to 8 years. So if you are you can still receive the vaccine and this immunoglobulin up to theoretically for several years after proven exposure. Another case, 3 immigrants to US with rabies who migrated from Thailand, Philippines, and Mexico. The genetic sequence showed that they developed this rabies, and the virus belonged to their particular country only. Okay, so they developed rabies 4 years, 6 years, and 11 months after their travel. Okay, so incubation period can be really, really long. So that translates that in a patient with unexplained viral encephalitis, probably it could be rabies as well. Okay, because the incubation period is very long, he might have forgotten a puppy lick or bite. Okay, so be very, very careful, especially in nowadays. So the prodromal symptoms can very non-specific, usually last for 7 days. Okay? Low-grade fever, chills, malaise, weakness, fatigue, anorexia, sore throat. So these are all symptoms that patient may develop rabies, but it is very difficult to diagnose at this stage. Okay, you may get photophobia as well. Okay, it lasts for around 1 week, and it is said that the sensory symptom from the bite, the tingling sensation, it is very specific for that patient may be going into the rabies state, but you may get itching, burning, localized abdominal temperature sensation as well from the bite site. Okay. And there is one finding called percussion myoedema. You percuss on the muscle and muscle will contract, just like in severe hypothyroidism. That may be also a feature of rabies during the prodromal symptom as well as throughout the symptomatic period. The clinical rabies, mainly it is majority of them, it runs in an encephalitis. That is equivalent to the furious rabies seen in animals. 80% cases you get encephalitis, but in 20% cases you get Guillain-Barré like paralytic syndrome. That is the dumb rabies that is equivalent to the dumb rabies in animals. So in a patient with GBS, rabies is a real good possibility, especially if he develops altered sensorium and encephalitis features later on. Okay. So encephalitis stage is characterized by fever, hydrophobia, pharyngeal spasm, hyperactivity, later leading to paralysis, coma, and death. Okay. You may get hydrophobia in not all cases. You may get hydrophobia. It's around 30 to 50% cases. And in around 10% cases, you may get aerophobia. You just show a piece of paper on the patient's face, and suddenly he will develop laryngeal spasm. This is a very specific test. Okay, you can do with the case sheets usually. And you may get severe extensor posturing of isotonus, nuchal rigidity, autonomic instability, myotonus as the disease progresses. And paralytic rabies, it is you won't get encephalitis, you get GBS. Later, it might progress to encephalitis or coma. Okay. So this is from my own paper. The initial impression of a rabies case. So what the initial doctors thought before diagnosing that it is a full case rabies: panic disorder, tetanus, drug intoxication, withdrawal, CNS vasculitis, anxiety, aseptic meningitis, sinusitis, pneumonia, severe hyponatremia, atypical chest pain, severe abdominal pain. So these are all in a weird way by which the patient with rabies can present. Okay. So be very, very careful. In a patient, somebody coming with abdominal pain, theoretically can be rabies. Okay. The postmortem diagnosis, the diagnostic test, the postmortem diagnosis is very simple. You can take out the whole brain and send it to the lab. Okay, but antemortem diagnosis, the main diagnostic test will be polymerase chain reaction from the nape of the neck skin biopsy. Okay, you can take out the biopsy from the skin. You have to call the dermatologist. At least around 10 hair follicles should be there in the full thickness. So dermatologist will help you. And PCR testing from saliva. If you send 3 or more samples, the yield is almost 100%. You may send the sequence. This is the humans. Serological tests are equivocal. You may there can be a lag period around 7 to 10 days, and even CSF antibody in the first 7 days, you may not get the CSF antibody in the patient. But if you get a CSF antibody from the human, even if it is vaccinated prior, that suggests rabies encephalitis. Okay, so these are the sensitivity, specificity of the various tests. The most sensitive and specific test will be a hemi-nested PCR. Okay, polymerase chain reaction from the skin biopsy. That is the most specific test. And conventional RT-PCR from the saliva, if you send multiple samples, the yield can be very high. Okay. The treatment, generally, it is palliative comfort care if you are a confirmed case of rabies. But nowadays, with advances in critical care, and they are even aggressive approaches also described in order to save the patient. Okay, this is generally aggressive approach is selected when the patient is young and he had received at least a few doses of vaccine. Okay, those who have survived, most of them have received a few doses of vaccine at least, and those who are ready to accept severe neurological sequelae. Okay, it can leave with a severe neurological sequelae if you are proceeding with to aggressive approach. Okay, the cornerstone of treatment is symptomatic critical care. You give ventilator support, dopamine, vitamin, relaxants, all that. That is left to the critical care specialist. And in between, along with that, you may try several unproven therapies. There are no randomized trials on this. Okay, which include you can give immunotherapy, vaccine plus immunoglobulin you can try. And one of the problem with this immunoglobulin is that it may not cross the blood-brain barrier, the immunoglobulin. So you may try osmotic agents and some ultrasonic waves. These are all research methods tried in very advanced centers. And antiviral therapy includes, you can try intrathecal interferon alpha, intrathecal. Ribavirin can be tried, but there are no proven. Ribavirin has shown some in vitro activity, but in vivo mouse models it has shown. There is no evidence. Neuroprotective therapy includes therapeutic coma and brain hypothermia and trying this ketone. Okay. Okay, these are all experimental. Even if you are proceeding with the aggressive, you can try. Okay, in the post-exposure prophylaxis, just given all of you must have familiar with vaccine and even rabies immunoglobulin. Okay, So several types of vaccines are available. All of them are equally effective. Diploid cell, vero cell, all. And generally, the vaccine should not be administered to the root layer. Okay, you have to give it to the deltoid. That is the most important thing. And human rabies immunoglobulin, it is collected from hyperimmunous human donors. Okay, it is the dose is 20 international units per kg, maximum 1,500, and it can be equine derived as well. The dose is around 40 international units per kilogram body weight. Okay, human as well as equine. So I will go to the details later, but generally, if you are planning to give this immunoglobulin, as much as dose should be infiltrated around the wound. Okay, around the wound. That is the most important thing. Rest of them should be given to the deltoid. Okay, and if the wound is very large and you have left with a small amount, then you can dilute with the saline and then inject around the wound as much as possible. Okay, to the level at which the bite has occurred. That is the depth at which you should infiltrate. That's what the literature says. Okay. And now we have monoclonal antibodies against this rabies. So this is a trial showing very excellent immune response with monoclonal antibody cocktail for rabies. This is very safe, very cheap. One brand is available, Rabies Shield. I think any of them you have tried, Dr. No, it is available actually. I have given to one patient. It is very cheap. The whole, the 3.33 international units per kilogram is a recommended dose. The total cost will be around 3,500, but the human, I think it's very expensive. It's around 40,000, 30,000 rupees. It's very expensive. So this is now endorsed by Indian Academy of Pediatrics. WHO is encouraging to use it. It didn't get into the guideline, but it is as good as human rabies immunoglobulin. The WHO says it should be encouraged. It is available in the market. This is monoclonal antibody, yeah? Monoclonal antibody. Rabies shield. Okay. That's exactly. And before deciding to give the post-extra prophylaxis, you need to do a risk assessment. For example, this happened in US. Okay, a rabbit, a bat was found dead in a school. Okay, so several of the students they touched the bat. Later, the bat was sent to a veterinary facility, and they found that bat was rabid. Then all of the parents came and asked for this. Our kid need to be immunized. Okay, so the expert analyzed the scenario and assessed the risk. Okay, so the dead bat was touched and by several students. Okay, so 107 persons were assessed, and only 1 person was eligible for the receive the vaccine because this particular student put his finger into the inside the bat's mouth. So they decided they will give a prophylaxis to only for this patient, for this particular student.
Is what type of bat?
Bat. Oval. Yes.
There are two types of bats. The vampire bat and silver bats.
That.
One is very small and one is big. That's why. Both descriptions, the virus is different in race.
Yeah, but it belongs to Lissa virus, and our vaccine and immunoglobulin will cover a broad. Yes.
Vampire bats, it's a different genotype.
Okay. And this bat-derived this thing is seen only in US, Mexico, and North America and South America. In India, it has been reported a few cases in Northeast. A few bats have been reported. Otherwise, in the rest of the world, a bat-derived rabies is not seen. It's only on the New World. I mean, South Americas and Mexico. Okay, so you may consider the risk like provoked versus unprovoked bite. Okay, if a dog is inside the house, it is a provoked bite, then you may differ. Okay, domestic animals, if it is low risk of exposure, you may differ. Animal is alive. This is applicable to cats and dogs for observation for 10 days. A few years back, when I went to my cousin's house, a cat scratched at me. Okay, so So I kept an alarm in the mobile, and after 10 days, I asked whether cat is alive or not. It was alive, so I didn't take anything. So you can do like that. The risk is low, you can postpone. And if the animal is available for examination, okay, you can take out the brain and examine for rabies, it's okay. And wild terrestrial mammals like fox and jackards, mongoose always take this vaccination. It is, and squirrels, rats, and mice, there is no need for taking vaccination. Okay, the category of exposure, just to highlight this thing that, see, category 3 is with visible blood. Okay, category 3. Category 2 is just abrasion. And category 1, it is touching or feeding animal or lick on intact skin. Okay, so category 1, there is no required for any post-structure prophylaxis. Okay, drinking milk or touching the, feeding the dog, etc. Even if it is proved this thing. And abrasions, it may require vaccine. And if there is blood coming after the bite, then you have to take the immunoglobulin as well. Okay. So this is the recommendation of the WHO. The US guideline differ. They give vaccine with immunoglobulin for everything. Okay. Now we are giving intradermal as well. So intradermal. Intradermal is you can give. So okay. So these are the category. So I have marked that to get used to this intramuscular practice, I have marked the intramuscular with this blue box. So category 2, the recommended dosing is 0, 3, 7 and between 14 and 28. The 4 doses are recommended. Okay. Previously, they used to give 5 doses, but nowadays the 5th dose is given only for immunocompromised patient, like transplant patient on steroids and all. Though the 5th dose is not mandatory. Okay. So it is given in 0, 3, 7 and 14 and 28. Okay. If it is intradermal, then the dose is different. For example, you have to give 2 sites intradermal on 0, 3 and 7. Okay. Give here and 2 sites simultaneously. And patient who has been previously immunized, you need to give intramuscular on 0, 3, 0 and 3. Okay. So these sequence, scheduling is available in the internet. You can intradermal, 1 site intradermal on days 0 and 3 or 4 site intradermal on day 0. This is who has been previously immunized. This is the recommendation. It is category 3. The scheduling is same, and you have to give rabies immunoglobulin. Okay, and patient who has previously immunized, who developed gets a category 3 bite, there is no need for giving immunoglobulin. Okay, that is the difference. Which one? Yeah, immunization should be given as soon as possible. But if you have started the vaccination,
I'm asking the prior immunization.
Yeah. See, usually for professionals like Dr. Ranjini, they need to measure this antibody level very frequently. Okay, and if it is less than 0.5, but they keep a very high standard, 50, you need to take the booster dose. Okay, but if you have taken 1 dose at any time, then it is expected to give lifelong immunity. Yeah, there is nothing like that. Okay, so you need to take only a few boosters. This thing. Exposure prophylaxis is considered for professionals that consist of 2 site ID intradermal administered on 0.7 or 1 site intramuscular given at 0 and 7. Okay, this is pre-exposure prophylaxis. I think probably in the future you all will go for pre-exposure prophylaxis. Even I am thinking you can buy 1 vial for 200 rupees to 360 rupees and give intradermal to all of your family members. Then okay, the failure of rabies vaccine and after full post-setup prophylaxis is extremely rare. Actually. Very rare. The reported is 1 in 20 million. Okay, that usually involves failure of 1 or more deviations. Okay, maybe they didn't follow proper washing, they didn't give the full dose, they missed the sequence, etc. Okay, so and quality of vaccine we don't know. That may be one of the reasons that is mentioned in the WHO sites. Okay. Prevention of, for example, the post-exposure prophylaxis can be very effective. This is a case report of a transplant recipient, one kidney recipient with no reported exposure. Okay, he died of rabies 18 months after transplantation. Okay, he had received one kidney and he died due to rabies. Now the donor tissue was traced. It was examined. They found that rabies was there. Okay, so immediately 3 of the other recipients were traced, and they were given this vaccine and immunoglobulin, and they survived. Okay, so it can be, the immunoglobulin can be given at any time. Okay, this is after 18 months of transplant. The current scenario. So why people are dying now? That is the question. Okay, so I contacted the Trivandrum officials. They said there has been 21 deaths reported due to rabies in the recent times. Okay, and 6 of them happen in fully vaccinated individuals. Fully vaccinated. No, 6 of them happen in vaccinated individuals. Most of them didn't take the vaccine. Okay, and 5 of them received full course. But unfortunately, all of the bites were on the face or the hands. Okay, so what will be the reason for this death? Okay, vaccine failure is extremely rare actually. The quality of vaccine, they said that it is released after proper checking and all, and they are analyzing, but so far there is no data regarding the quality of vaccine. Virus mutations, very, very unlikely. Okay, this Lissa virus mutation is very unlikely. Even this vaccine and the immunoglobulin will cover a broad variety of Lissa virus. Okay, and if that's the case, more and more cases should be reported. That is, which is not happening. Okay, so that is very unlikely. So the only explanation is probably there are more dogs, more bites, and more bites on the face, leading to rapid progression. Maybe the virus is reaching the brain very quickly before our vaccine and immunoglobulin can act. That may be the reason. Very high viral load exposed on the face may be the reason that people are more dying. Now there is a national action plan for dog-mediated rabies elimination. I think Dr. Ranjini will be talking up. I haven't gone into the detail. This is just a poster from this. We will be eliminating dog-mediated rabies by 2030. Okay, so we can wait till then. Thank you very much. Yeah. No, there is no scientific evidence. Ribavirin has shown benefit in vitro. In cellular culture, it has been shown to inhibit, but in mouse models, it failed. Humans, there have been tried, but there is no randomized controlled trial or there is no much evidence. These are all experimental.
Antivirus were tried in the industry. One drug survives, 6% survive. Survival is because the antiviral drugs are not. It cannot be because there is no structural damage to the brain. There is only a neuronal transmitter
എല്ലാവർക്കും നമസ്കാരം. Shall I start with the presentation? It's the current updates of rabies. So, rabies is a direct viral zoonosis. Why it is called as direct viral zoonosis? Direct means the entire transmission cycle of the virus. Only one vertebrate host is involved. So it is called as direct zoonosis. In the case of rabies, we can see one reservoir host is dog, and other it is we can see cat, then bats. These are all reservoirs. So these are the vertebrate host, and it is a global threat. The fatality rate is 100% in humans and animals. Every year, as per WHO, 59,000 people were died due to human rabies in the world only, and in India, 20,000 deaths was reported. in which the 99% of human rabies cases were due to bite from infected dogs. And more than 80% of rabies occurs in rural areas with limited access to the health education campaign and negligence of the post-bite treatment and prophylactic schedule. Then half of the victims are the children below 15 years. I think the children are playing with the pet animals and they don't know they will bite or not. That's the reason that rabies report was more in children. So sir has already mentioned about the structure, everything regarding rabies. Then it's a neurotropic virus and it can cause the acute progressive viral encephalitis. And the peculiarity of this Lisa virus, it is a single-stranded RNA virus and it is an enveloped virus and it is the primarily transmission through the saliva of the infected animal, and the saliva become infectious few days prior to the clinical signs. The first, at the site of entry of the virus, that will replicate in the muscle tissue and it enters through the nervous system into the neuromuscular junction and it can cause viremia. Then transmission cycle and pathogenesis. The bite of infection, the virus, I'm showing the diagrammatic representation only. So the transmission cycle, there are two types. One is the urban cycle and the second cycle is the sylvatic cycle. In the transmission cycle, it's urban. Normally dogs and cats, the urban cycle is predominant. And from wild animals, some rabies occurred. This may be the sylvatic cycle. So no hematogenous route of transmission. Sir has already mentioned some aerosol transmission, but with the aerosol transmission of rabies virus, it's very rare. So incubation period, it is prolonged and variable. In case of dogs, it is 10 days to 6 months, and in cattle, it is 25 days to more than 5 months. Then the excretion of virus in dogs and cats, it is 1 to 5 days, and cattle 1 to 2 days. And bats, it is 2 weeks. Then coming to the clinical signs in dogs. In dogs, there are two forms of rabies. One is furious form, that is the encephalitic form. 75 to 80% cases, the furious form will be seen. And the main symptoms are hyperesthesia, that's hypersensitivity to touch, light, and sound. And dog will eat unusual things, example the chapels, then wires or meshes in the kennel. Then in the dumb form, it is paralytic form. The 20 to 25% cases, the paralytic form will be occur. The first symptoms will be seen is the paralysis of the throat and zoonosis. That means the dogs cannot eat or swallow food directly. Then we can see some disorientation, then incoordination and staggering. Then paralysis of hind limbs, loss of appetite, weakness, seizures, and sudden death. So this is the furious form, and second one is the dumb form. Then the communicability of the disease. In furious form, the more virus dissemination is there. The carnivores are more efficient vectors than herbivores. The herbivores to herbivores transmission is uncommon. The clinical signs in cats, the cats become less affectionate or usually agitated or excited, increased aggressive behavior, drooling and foaming around the mouth, and paralysis, then death. Then clinical signs in cattle. Normally in cattle, we can see the attacking behavior and the milk yield will be reduced. Then abnormal sound that can be heard from a particular distance, that is known as bellowing, and difficulty in swallowing, then frequent urination, excessive salivation, and death. In goats also somewhat similar behavior, but in cattle we are called, it is bellowing, that the sound produced by cattle it is called as bellowing, and in goats we are called, it is bleating. Then goat will die within 1 to 5 days. So the diagnostic part, we cannot diagnose by doing doing postmortem examination because in case of rabies, no pathognomonic lesion were noticed. So while opening that carcass, we can see the stomach may contain some abnormal objects because they will eat some of the abnormal objects like nails or sometimes chappals. So we can see some of the items like that in the stomach. Then if you take the histopathological lesions, these are the lesions we can see. Then earlier in the diagnostic part, they were doing Nigri body examination. So these Nigri bodies are the cytoplasmic inclusion bodies found in the neuron. But the disadvantage of these Nigri bodies is Nigri bodies can be seen in some cases only, but not in all cases. Here we will collect the samples from the hippocampus only. So now we are not using this Nigri body as a diagnostic tool. Then Rabies diagnostic labs in Kerala under AST, that's Animal Husbandry Department. One is my reference laboratory, that is State Institute for Animal Diseases, Palot. And second, Regional Disease Diagnostic Laboratory, Kannur. Then Avian Disease Diagnostic Laboratory, Tiruvalla. Then Maxi ELISA Laboratory, Palakkad. And District Veterinary Center, Kollam. So diagnosis, we can use different tests. That is FAT, that is fluorescent antibody technique. That is the gold standard test for using diagnosis of rabies. This test is more effective in case of fresh samples. Then ELISA is there. We can use antigen ELISA. Then real-time PCR. Nowadays, one new machine for the mini PCR. That mini PCR, we will get the result within 2 hours. Then immunohistochemistry, these are the diagnostic goals. But we are in our lab, we are using fluorescent antibody technique. So I already mentioned about the Nigri bodies. They are eosinophilic, sharply outlined pathognomonic inclusion bodies found in the cytoplasm of certain nerve cells, especially in the pyramidal cells. So that purpose, we are taking the sample from the hippocampus. So this is our lab, that is Regional Disease Diagnostic Laboratory, Kannur. So this rabies diagnostic lab. So coming to the postmortem, postmortem means the collection of samples for the rabies diagnosis. Rabies diagnosis in a samples collect. Normally, we are taking, in case of large animals, we are taking the head part of the animal. And in case of small animals, like dog, cat, and wild animals like fox, jackals, we are receiving the entire carcass or entire carcass only. So in the sample collection, there are 2 methods. One it is the open skull method. In the open skull method, we are opening the entire skull of the animal and exposing the brain. For at that time, we are exposing the brain, it is more hazardous to the laboratory workers. Then an alternative method we can use, that is the occipital foramen method. Here, one straw is connected to the syringe, is introduced into the occipital foramen. And this is also a good method for sample collection. So this is the open skull method. So the best sample for fluorescent antibody technique is the brainstem. So we can use, instead of brainstem, we can use cerebellum, hippocampus. We will get the result by using this cerebellum and hippocampus also. So this is the sample we are taken. So we are taking sample that the brain impression smear, and this brain impressions we are fixing acetone for 1.5 hour, or we can fix the impression smear in acetone for overnight. Then after this acetone fixation, we can take the slide and we can air dry it, and we can pour 50 microliter of FITC antibody conjugate that we will get it from different companies. Then after pouring this 50 microliter of FITC antibody conjugate, we can incubate this impression smear in 37 degrees Celsius for 30 minutes. Then after the incubation, we are taking the slides and wash in 10% PBS buffer. Then we can air dry the slide and examine under fluorescent microscope. In positive cases, we can get a greenish fluorescence that we can see in the image, and negative fluorescence, only that background of the microscope will be there. That will be in a dark color. So sample collection precautions. Samples എടുത്ത് ഏകദേശം 48 hours-നുള്ളിൽ സ്പെസിമെൻ ലാബിൽ എത്തണം അണ്ടർ റെഫ്രിജറേഷൻ. കാരണം എന്ന് വെച്ച് കഴിഞ്ഞാൽ നമ്മുടെ ജെൽ പാക്സിന് മാക്സിമം 48 hours കപ്പാസിറ്റി മാത്രമേ ഉള്ളൂ. അതുകൊണ്ട് തന്നെ 48 hours കഴിഞ്ഞു കഴിഞ്ഞാൽ ജെൽ പാക്ക് റീപ്ലേസ് ചെയ്യേണ്ടി വരും. Then freezing of the sample will not reduce the sensitivity of this test. Then biocontainment during transport, it is very critical. Then if you get a green color brain sample or a desiccated sample or an unrecognizable gross anatomical sample, will indicate an unsatisfactory sample. So we will get a negative result on deteriorated tissues. So this is one of the incidents of rabies in male buffalo at Kolacheri Panchayat. So കൊളച്ചേരി പഞ്ചായത്തിൽ നിന്ന് കിട്ടിയ റിപ്പോർട്ട് പ്രകാരം ഈ ഒരു പോത്തിന്റെ ഒരു കാർക്കസ് ആണ് അവിടെ ഉള്ളത്. അവർ പറഞ്ഞ ഒരു അബ്നോർമൽ ബിഹേവിയറും ഫ്രീക്വന്റ് ബെലോയിങ് ഉണ്ടെന്ന് പറഞ്ഞിട്ട് നമ്മൾ ആ സൈറ്റ് വിസിറ്റ് ചെയ്തിട്ട് ഹെഡ് കട്ട് ചെയ്ത് കൊണ്ടുവരുമായിരുന്നു. സോ ആഫ്റ്റർ കണ്ടക്ഷൻ ഓഫ് ഫ്ലൂറസെന്റ് ആന്റിബോഡി ടെക്നിക്, the result become positive. We can see the greenish fluorescence there. So this is the rabies in fox. This is the lateral flow test. Lateral flow test. We can see the positive line and one control line. So this is another test. So this is another case of rabies in human. On 24/12/2020, a 12-year-old girl was presented to MIMS Kannur with a history of aggressive behavior, irrelevant talk, difficulty in drinking water, and schizophrenia. There was a history of dog bite in September 15. She was not taken post-exposure vaccination for rabies at that time. On 24/12/20 evening, the girl died. The doctor was suspecting rabies, and the corneal impression smear was sent to RDDL Kannur for confirmatory diagnosis. The sample was positive for rabies. So rabies diagnosed in human. 2022 up to August, the sample tested, it is 29, and the 10 cases were positive. And 2021-22, 21 samples tested and 4 were positive. 2020-21, 13 samples tested, 3 were positive. 2019-20, 12 samples tested and 2 were positive. So the prevention and control method, the most important method is the prophylactic and post-exposure vaccination, then stray dog population control, public health education, registration and licensing of all domestic dogs. So the Animal Husbandry Department has implemented 2 projects. One, it is the RFK-VC Vision 2030, that is Rabies Free Kerala Vaccination Campaign. Here we are doing the prophylactic vaccination of dogs and cats. And the second one is the animal birth control program. In Kannur district, only one ABC center is there, that is in Papinshiri. Recently, we are introducing a new ABC center in Padiyur to do the animal birth control. Here, we are doing the spaying in female dogs and castration in male stray dogs. So this is the ABC program conducted in Papinshiri Veterinary Hospital. So this is some of the data regarding the animal birth control projects. In 2017, 2124 spaying and castration were done. and 2018 2456 and 2019 13339. 2020 up to September it is 749. So rabies is a fatal disease and dangerous to the public health problem. The public health education workshop should be organized to educate people about responsible pet ownership and routine veterinary care. Local self-government and animal welfare organization to take necessary measures to reduce stray dog population. Thank you. 2 days munne.
The cows make such sounds during the heat season also, right after harvest time.
No, sir, that sound it is different from this sound.
Because we have that house.
Note the peculiar sound, sir. We can see the excessive salivation also. No, this is the car. അതായത് 2 ദിവസം മുന്നേ അത് വേണ്ട 2 ദിവസം മുന്നേ ചിറ്റാരിപ്പറമ്പ് പഞ്ചായത്തില് ഇതേപോലെ ഒരു റാബിസ് സസ്പെക്ടഡ് കേസ് ഉണ്ടെന്ന് പറഞ്ഞിട്ട് ഫീൽഡ് വിസിറ്റ് ചെയ്തപ്പോൾ എടുത്ത വീഡിയോ ആണ്. അവിടെ നിന്നുള്ള കാർക്കസ് ഡിസ്പോസൽ ആണ് കാണുന്നത്. അപ്രോക്സിമേറ്റ് 4 feet എങ്കിലും നമ്മൾ കുഴിക്കുന്ന ആ കുഴിക്ക് ഉണ്ടായിരിക്കണം. അതിന്റെ മുകളിൽ ഇടുന്ന കുമ്മായം.
Yeah, so the vaccine should be given with the enzymes. The glucose should be avoided because there is less even if one modular opposite the biggest bulk for anyway, 5 years. Yeah. There has been no transmission as a reported, but if a patient who rabies bites another human, you are advised to take the vaccine and
during the protocol stage or incubation or while in legal disease.
Not in incubation, programmer and throughout the disease. Yes, yes. That's a problem. We don't know. Maybe we are in space.
Universal pre-exposure. And then
Future development. Yeah, they want to because you know where there are countries. Yeah, Europe and US have all the possible vaccinated. So because they don't have to take. They are rich countries, you know. But the more countries they want to have vaccinated.
Because dog is a domestic animal. It's not a pet. Robots are made by human beings for transport and for
Yes.
there cannot be and there should not be a dog in the room. It should be in the compound. If it has come out and become one meter and there are lots of the dogs in front of the white. That's what the system does not attach to many other countries. The Japan is not running over this. Is out. There is no way to support the last so many years because dog has it. So there cannot be a dog on the road. It has to get the related by bias and government. There is not like something. So it's a domestic animal. So you have to give the compound or the house or the compound or the not do. So the responsibility of the government to do that. Without that, because why the dogs are white is children. It is not only because they are empty, but the dog is the that is not because of the dog. So when the size of the prey is small, the animal has got an instinct to attack the prey when it is smaller than an animal. So the many tigers are attacked when they are catching the dog, and they may not attack the animal. So that is the animal instinct. I am one person who has studied probability.
Yes.
When I was a student, I had both and strategies. Way back in 1926, around injection at that time, not the modern culture vaccine. That is a public health vaccine. There were two vaccines at that time. No, there was a dog in university. And it was all coming near us. One day, one fine morning, the dog was missing. Everybody said that the dog had rabies and died. So we went to take those injections and all. Fortunately, there were two types of vaccines at that time. The fabrican vaccine is called the central vaccine and the other was the vaccine. The difference is that one is a phenol inactivated and the other is a beta proteolactic inactivated vaccine. So, Dr. Eliezer, we were to get the vaccine from Kannur. So we all these two injections. Actually, what has happened was that Dr. Ramnayan, who became the director of the plastic surgery, he was conducting a research on regeneration of diabetes. He took the dog to animal house and delivered the vaccine. So that is why the dog was missing. Not that the dog had rabies. They don't see that Ramnayan was attacked and dog was open installation. Second thing that I was in the district hospital. The majority of the movie is because of the either because of adverse and more about dog weight. So we call it unmoving bacteria. That's why we have that's why if we want to avoid rabies, there should not be a spread. If patti is now spread or not, it is better going on. Patti is same on the road. Matters are pure animal patti is same on the road patti on the line.
Proper waste disposal ഇല്ലാതെ waste disposal ഇല്ലാതെ waste disposal പ്രത്യേക മെക്കാനിസം ഇല്ലാതെ straight up
അങ്ങനെ ലഘുവൽക്കരിക്കുന്ന ഒരു കാര്യമില്ല. വേസ്റ്റ് ഡിസ്പോസലോട് വേസ്റ്റ് ഈച്ചി ഒക്കെ ഉണ്ടാവാതെ അല്ലാതെ പട്ടിയും പൂച്ചയും വേസ്റ്റ് ഉണ്ടാകും. വേസ്റ്റ് സോ പട്ടി ഉണ്ടാവുന്നത് വേറൊരു പട്ടിയും അല്ലാണ്ട് വേസ്റ്റ് ഇല്ലാതെ നമ്മളവിടെ തിന്ന് ബാക്കി ചിക്കൻ എടുത്തുകൊണ്ട് വീട്ടിലുണ്ടായത് അതിനകത്ത് പട്ടി ഉണ്ടാവില്ല. അതൊരു വിട്ടിത്തരാണ്. ബിക്കോസ് അപ്പൊ പട്ടി ഇവിടെ നിന്ന പട്ടി വേറെ സ്ഥലത്തേക്ക് ഭക്ഷണം എടുക്കുന്നതിലേക്ക് പോവുകയായിരുന്നു. സോ സ്ട്രീറ്റിൽ എവിടെയും പട്ടിയില്ലെങ്കിൽ എത്ര വേസ്റ്റ് ഇട്ടാലും ആ വേസ്റ്റിലാകുന്ന പട്ടി ഉണ്ടാവില്ല, ഈച്ചയും കൊണ്ടുമൊക്കെ ഉണ്ടാവില്ല. ആ ആർഗ്യുമെന്റ് So you want that it's mad or putting it out and get ready for the other സ്വയം ഒഴിവാക്കി വേറെ കൊല്ലല്ലാതെ വേറെ ഒരു വ്യക്തിയില്ല. അവര് ആ പട്ടിത്തോളം അപ്പൊ അതെല്ലാം പട്ടി പട്ടി പ്രോപ്പർട്ടി ഫ്രീ ആയിട്ടാണ് വീട്ടിലുള്ള എല്ലാവരും കുത്തി വെക്കണം. അതാണ്
അവിടെ നായ്ക്കളൊന്നും കാണാറില്ല. എന്തുകൊണ്ട്? നായ്ക്കളൊക്കെ ആൾക്കാരെ അവിടെ ആ ഒരു പട്ടീനെ അയാളിങ്ങനെ കെയർഫുൾ ആയിട്ടാണ് നടക്കുന്നത്. എന്താണ് എവിടെയും പട്ടികളെ കാണാം.
Because this is the only disease for which we are taking a post-exposure prophylaxis. Probably tetanus also to some extent. All of the disease we are taking a pre-exposure prophylaxis. So prophylaxis will only because the incubation period is long. That's what. With the person given to die. The argument was that there were antibodies detected in the brain, so the injection was effective. Because in a clinical disease, by a stray dog bites, where people develop rabies, at the onset of rabies, antibodies will be there in the brain. Yes, this girl who took the sample when the patient developed clinical rabies. So the antibodies present in the brain may be to inject or maybe to the disease. So that's how it is. You can teach the public, not the person to know the pathogens and pathology. So the peculiarities of this disease is that it's a disease with a very long and very incubation period from 7 days, 10 days to 10 days. That's it. In many of the, there is no organic or changes in the brain cells. Only the neuronal transcripts there are changes. And in 6% of the cases, no will fight. The recent study by the MNAMS Institute say that out of 36 rabbit cases, in 6 there was no bite at all. Even in America, it is so that because of many other reasons, I don't want to go into the details. So if you want, the person, if the question regarding the result, every country has their own. So with the modern within 6 days, 7 days, the protective antibody level of 0.5 international limits will be reached. And the vaccine should have a potential of 2.5, more than 2.5 international limits. That is a fact. So, if you want to prevent rabies, you have to control the stray. There should be 0 stray dogs. on the road. There can be up to shelters, or there it can be killed. There is nothing wrong with killing dogs. Because we are using antibiotics to kill the bacteria. We are using antivirals to kill the virus. If the virus and the bacteria can be killed, if the other animals can be killed for eating, why not the dogs alone? What nonsense they are saying? And they are saying that you are putting subject is taken to another level. You are putting waste on the road. That's the wrong thing. Waste on the road will produce so many other things, rats and all. So it's not that the dog manage is not totally unrelated to the waste management. Other തെറ്റായ കാര്യങ്ങളാണ് പറഞ്ഞിട്ട് ഒന്ന് പറയുമ്പോൾ വേറെ അതുകൊണ്ട് പറഞ്ഞിട്ട് വിഷയം മാറ്റിയിട്ട് അതിന്റെ അങ്ങോട്ടേക്ക് കൊണ്ടുപോവാണ്. അപ്പോ വേറെ എന്തെങ്കിലും ചോദ്യം ചോദിച്ചാൽ ചോദ്യത്തിനുള്ള ഉത്തരം പറയാതെ വേറെ ഒന്നും പറയുന്നില്ല. The total evaluation of rabies from the world is not possible because there is a wide reservoir for this. Bats in Mexico, both the grandparent bats and single parent bats, all the viruses are reservoir. The virus was done in Chile some 10 years back using a genetically modified tomato given to the animals to make them immune. 3 levels the researchers are going on to control the wild rabies. But our question is, it is not possible to completely eradicate it. Our problem is to prevent human rabies. So to prevent human rabies, 97% of the cases are reported from dogs in India. Whereas usually a dog is cat, so if you prevent or avoid stray dogs and immunize all the domestic dogs, the immediate source of because the major cost in the treatment of rabid dog bites is immunoglobulin. So immunoglobulin has effects. It delays the antibody formation. The question is about why it is that. It is because delta is directly linked. If you go to subcutaneous, subcutaneous absorption is very. So the liver goes so that delta. You will one delta. What is the delta? Immunoglobulin and other delta vaccine because the vaccine, the immunoglobulin is going to destroy the virus. That's it. Why you are doing around the moon is because you want to kill the virus. So, yes, that's all. But you cannot travel with the rocket of power and so all the way when you are traveling. You say that 0 hour, golden hour, you want it. Nobody goes to some place to take water. Heavily raining and lot of
See, as per my understanding, when these multiple dogs gather, they develop a thing called pack behavior. They're trying to form and attack as a pack, wolf pack. And we discover that back in the surrounding. Then the entire attack will be ferocious.
Because the one of the dogs will go we domesticated dogs, nature typically stray dogs is more violent than the wild animals.
Okay. I think we stop.
So in this, how I see, it's a rabbit dog. If we are looking for the another dog in time or So if the patient is unbeaten and the dog survives. So we will think that maybe what the dog is dying on. So after 10 days, we will think that it's not travel. See, if the person in effect is if there is a diagnostic for the dog, that is what you are asking. This person was extensively studied and they say that I can do the things. They say that there is no diagnostic in the dogs. So before we used to observe the first 10 days. Why is it that is sending? The question is why is sending? Usually 4 days before the onset of the disease, the virus appears in the saliva. Usually from the moon side it goes to the brain, hippocampus and come back to the saliva and so it takes 4 days before that. Usually the animal live for 4 days in furious rabies. In them rabies, it's a question of different live after 15 days. So 6 plus 3 plus 4 7. 3 days will be this way, that way as well. So at the time of the room we make it 10. That's why the 10.
That produces, sir, that produces GVS, this
Anyway, thank you all for the interesting. What can I say? Most of dialogues. Yeah, and then I invite you to give a present to our. And then we'll call it a day. Now what is that?
There are excellent implementation session like this. Also thanks to senior members of the Thank you.
Meeting is.